Hello and welcome to another episode of the HSE Talking Health and Wellbeing podcast. My name is Fergal Fox, and on today's episode, we're looking back on the 2024 year of podcasts, and I'm joined today by my co-hosts, Noreen Turley and Eamon Keogh. You're very welcome to this podcast, guys.
Thank you very much, Fergal.
Thanks, Fergal.
So we're talking about where we've come from this year or where we've got to this year, and it's been a very busy year. I was just looking back on the schedule. We've done over 42, I think, episodes. So it's been busy, but I guess our overall objective this year was to make the podcast sustainable. Do you think we've done that, or how do you think we've got on? Noreen, can I start with you?
Yeah, sure. Well, I think we have. A lot of people throughout the service are coming to us now asking us to give them an opportunity to be on the podcast. So I think healthcare workers are really finding the benefit of it.
And Damon?
Yeah, I think so. It's great to see as well that we've added to the bank of episodes that we have, and the covering different topics this year as well has been really interesting. So I hope people find it of interest and useful.
Yeah, there's such a breadth of topics covered now from different organizations telling their story that we fund, different partners, and then so many staff sharing their expertise and insights. And as you highlighted before, Noreen, we have the benefit of calling on very experienced staff throughout the service onto our channel.
Oh, yeah, absolutely. To me, it's all about that. It's all about giving them the platform, giving people the platform to showcase the work that's been done at ground level and the impact that they're having, and giving them another channel to be able to get that information out to their local communities or to their colleagues. I think it's hugely valuable for them.
Yeah, and I want to thank the listeners, specifically, we often thank the listeners in the episode, but I've heard even just this week, talking to somebody planning another episode for next year, and they were telling me that they've often shared the episode in their WhatsApp groups, and other friends of theirs have shared the episode with them. So the sharing and the subscribing to the channel really helps us. So we really appreciate that support of the listeners. So thanks for that. But coming to you, Eamon, in terms of some of the highlights this year for you, the three of us took on different episodes, but you both know a lot about the work of the people that you're interviewing then by that experience, or you're working on the background with them on different things. What kind of stood out to you this year?
Oh, for me, I was lucky. I spoke to some great people this year, but I suppose some of the standouts, again, obesity has to come to the fore for me. It's such an important topic, and there's some great strides been made in the area. So it was great to speak with Donald O'Shea in episode 42 and Grace O'Malley in episode 73, just about obesity and their work in obesity. And they talked about, again, changing mindsets and breaking the stigma of obesity. And Donald talked specifically about the role of treatments in doing that. And we have a short clip now of him talking about that.
As a disease in its own right, I think that's been very important. We're still at the early stages of it.
Yeah.
I think, having been involved in this space for 30 years, to see that we're at the point where we're about to have availability of meaningful, safe, effective treatments for the disease of obesity. And that's important for two reasons. First of all, when you can treat a condition, you immediately start destigmatizing it, because people say, well, if there's a treatment, it must be a disease.
Thanks for sharing that, Eamon. That clip really highlights what we're trying to do there. And Donald O'Shea is so easy to listen to, and he's so passionate and dynamic about the way he communicates the work. I remember when he was in recording that podcast with you, and he was delighted to get the opportunity, going back to what Noreen said there. Like, it's good for us to be able to have that kind of experience and expertise to talk about the topics with, but it's also great for our health service staff to have a channel where they can go deep on a topic. It's very rare that we're able to have a kind of a half an hour conversation or a 40-minute conversation with somebody about their area of expertise in the health service. So I think it's a very valuable channel in terms of that.
Yeah, I'd agree with you there, Fergal. I think that, as you said, it allows us to go deep, but it also allows them the time and the space to really explain the service or the topic that they want to talk about. And sometimes, particularly, I think we live in a very fast media consumption age where we're often trying to get across our messages in a minute or 2 minutes or whatever it is on different social media channels. And we have our own health and wellbeing e-zine that does very well. And then we obviously have our own X social channel as well. But I think just the podcast gives us the time and space to explore those topics in a very meaningful way. And hopefully that listeners will get more out of it and really, I suppose, get some of the questions that they have answered in the 30, 40 minutes that we talk to people.
Yeah, I think looking back on some of the topics that were really popular this year, you can see that because we're promoting the podcast to the public, if you get the good guests and if you get the topic that the public want to listen to, just as you said there, Eamon, that there's a public want over having that deeper understanding or the practical information or tips or whatever it is. And I'm reminded of that podcast that you did with Dr. Clina Murphy and Dr. Grieva Hartley, Noreen, around menopause. That was one of our most popular episodes this year. That was number 46, Understanding Menopause.
Yeah, and even though that's not specifically our area of work, Fergal, I think that it just shows the breadth of professionals that we have access to and are willing to come on. A lot of them are international speakers and they're at the head of their game. So we have a wealth of information. Our guests are they're so professional. They're so knowledgeable in their area of expertise. And myself and Eamon do media training for staff as well. And it's the same message that we give to people at media training as well, is that trust in your knowledge, trust in your area of expertise, and just come as yourself and come and be authentic, because their passion and commitment is unbelievable as they discuss their chosen subject. You can't really capture that. You can't buy it. It's just within them. And it's just so amazing to hear the number of people who work for the HSE or work for our partner organisations who really love their work and really believe in what they're doing. And like I say, I just don't think you can buy that.
Yeah, I sat in on that episode, though. I suppose it was an education to me in terms of the menopause, and it was great to see it being so popular with the public.
I hope you shared it with your wife, Fergal.
Yeah. Well, I was thinking afterwards, I know I commented to Quiva and Clina that we were only kind of coming to the game now around educating women around menopause, but we have ways to go in terms of educating men. I think there's a huge want and need there as well. But it was very interesting for me to listen in on the recording of it. I found it, as you said, there's people very deep and on the top of their game, and we get to interview them and put it on the channel.
Yeah, the new services that they have developed, the Complex Menopause Clinic, and that's growing and growing because of the work that they've been doing. And I think that was something that we're going to try and come back to maybe next year around the whole area of complex menopause, which would be great.
So one of my standouts for the year was the Special Olympics episode I did with Dr. Kathy Fulcher and Jonathan Deering. And it really just hit home to me the work that Special Olympics Ireland are doing in relation to health equity and working with people with intellectual disabilities. And having Jonathan on, he's somebody that came on as a participant on the program years ago and now was helping out the program. And he spoke with such passion. And as you said, Noreen, their authenticity is the embodiment of what the Special Olympics Ireland do. I just thought it was so remarkable to get to talk to him, because just by his interview, he gives such a strong message and story about why people get involved. And of course, Special Olympics Ireland depend on a huge range of volunteers. Many of them work in the health service. But that one really kind of hit home to me. I felt like I learned an awful lot just by taking the opportunity to listen and talk to them. So we just listened to a little clip of that now.
To represent your country, not many athletes can say they've done it. But when you do it, it is the highest honour any athlete can get, because you're representing your country, you're representing the rest of the people who have come before you and who are going after you as well.
Yeah, very good.
Fergal, that brings to mind another episode that we did with Active Disability Ireland, Brenda O'Donnell and Lauren Waters from Active Disability Ireland, and they discussed their work to promote active lifestyles for people with disability. They kind of told us about Active Healthy Me programme, which aims to empower people with disabilities to take control of their own health and well-being through an education programme. And I thought that was very effective as well. And it was given a platform again to people with disability. Yeah, the other one, it's hard to pick favourites during the year, but the one that really I thought was very stark was the Being LGBTQI plus in Ireland, episode 72 with Dr. Matt Kennedy and Denise Croke, and talking to them about the reality of being LGBTQI plus in Ireland, the research findings that were published last April, the statistics around mental health are so stark for people, but listening to the kind of story behind that and the need to support workplaces and schools to be better understanding and to be positive places for people to be able to come out. There's just so much work I think we need to do around that in Irish society at this time. So we might play a little clip of that as well now.
People of my generation at that age of life and realising my sexual orientation was different, there was no representation, there was no visibility. I had no role models. I never saw the life that I intended to create for myself represented anywhere. And that created potentially negative mental health issues. But now there's a greater visibility, a greater openness. And that in itself is nearly a detriment, again, because you have people commenting on social media, and young people in particular are very exposed to social media. And you have all this vitriol and hate speech, to call a spade a spade. People are either commenting on the life that you are claiming for yourself or the identity you're trying to create for yourself.
Actually, Fergal, I was just thinking there, listening to Denise, it was great to have her on as a colleague in health and wellbeing, but it just struck me, we get a lot of input, obviously, from our healthcare colleagues, but we also have a lot of listeners who are healthcare colleagues as well. Actually, that was one of the bits of feedback that I've got from some of our colleagues, that they found the different episodes very useful, just even in terms of just information for them and stuff. And one of the episodes that stuck out for me was episode 57, where you spoke about consent and about the consent a healthcare worker should seek to explain a treatment or procedure to a child as well as a parent. I found that very interesting as a parent myself, just thinking at times where you're in that scenario.
Yeah, no, I found it interesting myself. And again, like I learned so much from that episode about how health service staff need to, consider the capacity of the people that are coming through their service. There's definitely some strong messages in there. And if we play a little clip here, just to remind people of some of those messages.
As well as bringing the parent or guardian up to speed on what they're proposing and listening to their questions and concerns, should equally be trying to explain it to the child in a way that they can understand, and listening to any concerns that the child might have or any other supports the child might have in order to be able to assent to the process.
I'll give you another harder example. Let's say I'm going to visit my father and he's got dementia, he's in a home, and I want to make a decision about his care with the staff in the centre where he's staying. Like, if that's done really well, what does that sound like to you?
When that's done really well, the family member, yourself in this example, your views as to your father's preferences are given a huge amount of weight and respect, because you obviously know him very well, you care for him, and you're a really good advocate for what he would want.
One of the podcasts that we had this year that was a big stressor for me, and was the one with Bernard Gloucester, our HSE CEO. We spoke to him down in Limerick. We did a full video recording of the podcast as well. It's up on our YouTube channel. Before I sat down with him, I was listening to different interviews that he did, and it was interesting. He's just so experienced with the media, and he gave us some great reflections on his 1 year in the job, and he has been a supporter and an ally for health and wellbeing for many years. So that was episode 47 that we had with Bernard Gloucester, and he told me about his own giving up cigarettes himself and the impact the workplace smoking ban had 20 years ago. And kind of was complimenting Micheál Martin, the work he'd done around that. But he definitely is very important for us as an ally in health and wellbeing.
Yeah, Fergal, actually, I thought it was very encouraging to hear him talk about the importance of integrated care and taking that holistic approach to healthcare. That was very encouraging to hear him speak like that. And we'll just listen to a short clip now.
But if you look at the multiplier in the demographic of the people who will be like Mrs. O'Neill, and unfortunately that generation and the generation behind it do have a significant prevalence of chronic illness and chronic disease, we do have to find those ways of that entire support system and that network. And that's really what community healthcare networks and integrated care teams for older people are about. They're about treating people at the lowest level of complexity. And I've seen the POP teams, I've seen what they've done, and I've sat with one of them with a relative, and that's exactly how it should be and how it needs to be.
Yeah. Okay, great. And thanks for that. I want to come back to you, Noreen. Any other podcasts that stood out to you in terms of your own experience as hosting or listening in this year?
So, Fergal, one of the other ones, or two actually, that come to mind for me is episode 64 on patient partnership that we recorded with Anne Lawler and Joe Ryan. And they just spoke about the importance of genuine patient involvement at every level of healthcare. And I know that this is something that the HSE is really trying to work on next year and developing that whole department. And throughout that, Joe really emphasised how working in partnership with patients and service users is the cornerstone really of how we work across the health system. And even though we've got this patient partnership, I can't believe the number of patient representatives that there are at different areas of the organisation. So for in screening, they have loads of patient partners. Then we did one with the National Cancer Control Programme on SunSmart and the critical importance of skin protection. And then we had a lady on called Bernie Rice, and Bernie even spoke about her daughter Sharon, who died of melanoma skin cancer. And she's been working on this since 2008, given her own free time, again, because it's something that she really believes in. And Anne Lawler is the chairperson of the 22q Association. And again, it's because her daughter is a person with 22q, and she gives her time and energy, time and time again, for the development of these services and to really have the patient's voice heard. So I really have to commend those people who do it tirelessly for nothing. They do it in their spare time. And we have another podcast coming out in 2025 with another very significant patient representative, John Wall, and his role in patient partnership in the Midwest. And again, it's the passion that he has and the commitment he has for the development of the patient's voice throughout the HSE at design stage, not just as a token, but giving patients real partnership within the whole system.
I'm looking forward to listening to that one, and fair play to John Wall. He helped us out with the launch of the Healthy Ireland Men Action Plan recently as well. You know, he's a very significant advocate for health and well-being and for men's health and, you know, prostate cancer and so many issues that he's, as you said there, he's kind of worked tirelessly among the other people that you've referenced. We play a little clip of one of those episodes. Noreen, what would you like to showcase there?
Yeah, I think that we should really just play a little piece of the patient partnership episode where Anne Lawler really describes the impact that patient partnership can have at every level of healthcare.
There's a different feel. It's not tokenistic. It's not engagement. It's actual genuine involvement. Because I think when you have that lived experience and clinical expertise and you bring them together, you get a very, very good outcome. And to me, that was partnership, and not just partnership, but it was active partnership.
One of the other things that we did this year, we got the opportunity to present at the National Health Promotion Conference in Galway to highlight the work of the podcast and the success of the podcast and the range of topics. And I also took the opportunity to speak with the keynote speakers even before the conference to kind of get their input on the conference team, mental health promotion. That allowed us to showcase some exceptional international experts and our own homegrown experts. And here's a little clip of Dr. Margaret Barry from the University of Galway giving her insight into mental health promotion itself.
The focus this year is quite interesting, that we are talking about a systems approach and looking what it means to really implement mental health promotion at a whole systems level. That's whole of government, whole of society. And this is actually, I suppose, quite different to where we were at 15 years ago when we were just trying to get the idea of good mental health on the agenda and how do we do that and how do we build up the evidence.
There's lots to reflect on. Is there any other episodes that you'd like to highlight before we move on, guys? Eamon, you mentioned one of the episodes you did with Safe Food.
Yeah, actually, that's one that really stuck with me this year. It's like that red car syndrome where somebody points out a red car and then that's all you can see. But when I spoke to Dr. Aileen McGloin and Nora Campbell, and they talked about the need for a food policy to support a healthier food environment, and I really noticed after that how unhealthy food has just been shoved in our faces from all corners across all different outlets. But Aileen talks here about the right for children to be protected from that constant bombardment of healthy food. And we'll just have a listen to a clip now.
Most of us have been working on this for a very long time, and voluntary codes have tended not to work. So what really works internationally is by bringing in legislation to protect children. You know, I think it's important to take a children's rights lens here. Children have a right to be protected. They have a right to survive and thrive. And only when we protect them in the context of the quality and type of food that they get can we ensure that that's the case. You know, this is about something that is fundamental to the health of a child.
Yeah, I'd encourage you to go back and listen on that episode because, as Eamon said there, it does discuss some of the themes that Donal O'Shea had highlighted, but in more depth around the healthy food environment and the Safe Food campaign that they developed. And you can still see on the Safe Food website, and you may see in some other public spaces around, you know, as Eamon said there, the challenge that parents and young people have when it comes to food environment. So, looking back on the year, some of the episodes have been really, really popular that we mightn't have expected. And we're always looking for episode suggestions and inviting people to write to us at healthandwellbeing.communications@hse.ie in terms of getting some feedback. But some of the episodes that I was a bit surprised at, the episodes that you did, Eamon, on gut health and back care, they were really, really popular. It's always encouraging as well and highlights that we're doing a decent job when we get feedback from the public or from healthcare staff about how they appreciated the episode. And an email that we got after your alcohol services podcast earlier in the year, Noreen, from somebody that had been through alcohol treatment and really appreciated talking about the service and listening to a service explain itself.
Yeah, and that was the alcohol one with Dr. Colin O'Driscoll, clinical lead, and Eleanor Keogh, a project worker. And they have years and years of experience working in addiction services. And at this time, they were talking about the integrated alcohol service, which is a relatively new service. And somebody contacted us then trying to get in touch with Eleanor to see how they can access a service like this in their own area. But that was only one of the alcohol podcasts that we did. Throughout the year, we've done ones with the Yoda Youth Drug and Alcohol Services, and that was episode 45. We have done one with the Alcohol Support Services, and then we did another one with the Alcohol Forum. And all of these got really quite good numbers listening to them. I recorded a couple earlier on today that'll be next year, and one of them is around alcohol and cancer, and the other one, again, was about parental support and parental advice for parents when they're talking to their kids about drinking and starting to drink. So they'll be coming up next year. And the good thing about that was we had a girl called Sive, who's 18, a young person, speaking about the challenges that they face every day in the community when it comes to alcohol and maybe peer pressure and that type of thing.
Yeah, again, like it's great when you have somebody speaking from their horse's mouth, as it were, a young person talk from their own experience. We look forward to that in the new year. So is there anything else you guys are looking forward to in the new year? We have a farmer Wellbeing episode coming up in the new year as well, and we hope to have a healthy new year episode. We're currently trying to finalise that. Is there anything you guys are looking forward to in terms of 2025?
What I'm looking forward to, I have to say, is seeing the content that we're going to record next year and the opportunities that present themselves. And also, I think what's encouraging is, just to mention one email there that I got from an educator who said that, she was making it part of her class's curriculum to listen to our podcast series. So I think that that's very encouraging in terms of that evidence and educational space to hear that our podcasts are being used like that. So I'm looking forward to seeing where we take it.
Yeah, I got a little video off my niece. She's in second year in college in Sligo, and they were all listening to an episode around the tips for healthy university life, which is great when you think you're getting support from the setting that you're targeting. Sorry, Noreen, you were coming in there?
No, really, as you gentlemen know, the Menopause podcast has the most listeners, and I hosted that one. I'd like to clarify that I hosted that one. It's at 4.9 thousand listeners, and I'm looking forward to have the most popular podcast in 2025 from HSE Talking Health and Wellbeing. So that's really what I'm looking forward to. That and the farmer one, obviously.
It tends to get a little competitive here, but Noreen is always out front.
Well, also Noreen actively campaigning all our media training sessions throughout 2024 to listen to her podcast.
I am lucky that most of the people who attend these sessions are females and they need to know this information. But all joking aside, what I'm really looking forward to is meeting the people that we interview. I mean, it's just, I'm gobsmacked every time we're recording when they come in and they talk about the service that they're delivering. They're talking about the people that they care for. And, one of the ones that we did on winter wellness last week, it was out with Dr. Rory Nee and Aoife Quinn. They came in to talk about winter wellness and how to prepare older people to stay well over winter. And then we started talking about their integrated service for older people in St. James's. And what they do every day is just mind-boggling. And they go out to people's houses, they keep people out of hospital for longer, they get people home from hospital quicker. And they're constantly trying to develop this service. And this service is around the country now, the integrated service for older people, or they call it ICPOP. But their commitment as well and their enthusiasm for their job and the team that they work with, of course, was fantastic. So they really lightened the mood in a difficult area of trying to tell people about how to stay well over winter. They had great tips.
Yeah, there was a lovely tone to that podcast. You can see they have a great working relationship, so the communication was easy. I'd like to give a few shout outs before we finish up there. We thanked the listeners already. We want to thank, in particular, as Noreen said, our own health service colleagues that have supported us both in the communication of the work and in the recording of the episodes. We can't do it without them. And I'd also like to give a shout out to Dr. Sharon Lambert and Sheila Shoga and Gary Kelly, who came on a webinar that we did back in October about how a podcast can help your health and well-being. I suppose part of the work is promoting podcast listening. And in that webinar, we had Dr. Sharon Lambert speak about how podcasts, through her research, she's found that podcasts can help decrease mental health stigma and increase hope and connection. And Noreen has done a good few podcasts now on mental health themes, and we're looking forward to hearing more about that. In the new year, there's going to be more mental health and wellbeing podcasts coming up in January, February, March. And it was great to have Sheila Shoga on talking about her own podcast, Ready to Be Real. And Gary Kelly, who supports us in terms of the podcast, gave us a lovely presentation in relation to how podcasts are kind of an ever increasing medium and been used throughout the world, globally, really, but how we're using them and why we're using them in the public service. So thanks in particular to all those. Any other reflections before we say goodbye, guys?
No, I suppose I'm also looking forward to one episode I did this year on the launch of the National Physical Activity Guidelines. So there's a lot of work that started and that will be done next year in relation to that. So I'm looking forward to where that goes, and hopefully we'll be talking more about that in 2025.
Okay, great. Well, Lucas, thank you to you both for joining me today, and thanks for all your work throughout the year. It really has given us a diversity of voices, and you've been able to follow up on your work, whether it's your webinars or your launches and different communications work. The podcast has served us well, and you've served it well, so I appreciate that. I mean, to you, the listener, we'd like to thank you again, and we hope that you give us continued support. Please share this episode with anybody you think would get value out of it. And if you'd like more information about HSE Health and Wellbeing, follow us on X or LinkedIn. We're now on LinkedIn as well, HSE Health and Wellbeing on LinkedIn. Take a look at our YouTube channel or register for our e-zine by emailing healthandwellbeing.communications@hse.ie. This has been the HSE Talking Health and Wellbeing podcast. Thank you for listening.